Hello students, let's quickly review the questions that came in Jain 2023. Now the first part was more of one-liners and second part was little lengthy, but at the same time अगर आप देखेंगे question में there was almost most of the MCQ there was some keywords that was there and that was directly heading towards the answer, right? So let's quickly recall the questions that came in the exam. So the first that was there from the notes, the necrotic migratory erythema that is seen in glucagonoma. Then there was a question from surgery, abdominal pain radiating towards the back, the bend-like pain that is seen in pancreatitis. Then there was two questions that came from the CSF examination, right? And in one of them that they have told there is a child and having the mononuclear cells, the lymphocytes were there, and that was of the tubercular origin. The second one, the students were unable to recall. As I will get more inputs, will reframe the question and will get back to that thing. Then the fifth question that was there was a straightforward and a very repeated question about the extradural hemorrhage. They have given the CT scan and the biconvex shape lesion that you can see, that was the extradural hemorrhage. Then the sixth question was again that was the heart failure that was asked last time also, that which of the following drug is going to decrease the mortality or that is going to increase the survival. That was the word that they have used. Increase the survival, that is the beta blocker, and among the given option that was metoprolol. Then the next question was the ascending motor paralysis. The paralysis, they said that it started from the lower limb, that it was ascending. That was a clear-cut GBS, Guillain-Barré syndrome. The eighth question that was there was they have given a long scenario. In that they have mentioned about the ascites, the distended neck veins, the pedal edema, and that was the question of the constrictive pericarditis that was leading to the right ventricle failure features. Then the next question, the ninth one, was a bedridden patient, and bedridden patient there is always a risk of formation of the deep vein thrombosis, as we have discussed in the class. The shortness of breath, sudden onset breathlessness, chest pain, these were the words that they have used. And then they asked that in that case which investigation you are going to do. We are going to do the pulmonary angiography. Then the next question that was there was a female that was given, and they have mentioned that the female is having headache with papillar edema, and they have used the word also increased ICT is there. So that was the pseudotumor cerebri. Then that was a straight question that they have asked previously also, a child who has taken multiple tablets of iron, 10 tablets or 15 tablets, and what is the antidote that we use for the iron toxicity, that is desferoxamine. The image was not given, and they have just written that the teeth discoloration is happening. First is the white, then it's the darkening that is happening, and that is because of the fluorosis. It's the fluorosis. The next was an old age male, and that he was having the lytic lesion on the pelvis. This was the word that they have used, the punched out lytic lesion. That was the key word, and the answer was the multiple myeloma. They have given the CRAP criteria also. The long scenario was given, hypercalcemia, anemia, everything was mentioned, but the key word was here. Then question from biochemistry was the melanin is synthesized from which amino acid? Melanin is synthesized from tyrosine. The question that they have asked many times in your exam, the maize eaters, they have always a tendency of tryptophan deficiency, and that leads to pellagra. Then there was a question from snowflake cataract. Snowflake cataract is seen in diabetes. It is due to accumulation of sorbitol. Along with that, they have given one more molecule. You were not able to get the correct reference for that, but because of the sorbitol, we were able to get the answer. 𝗬𝗃𝗃, it is due to vitamin A deficiency. 𝗬𝗃𝗃 is due to vitamin A deficiency. Then there was a question on the breastfeeding, that breastfeeding is absolutely contraindicated. In which condition? It is contraindicated in galactosemia. Wan-Jier-Ke disease, direct question, that Wan-Jier-Ke disease, which enzyme deficiency leads to Wan-Jier-Ke? It is the glucose 6-phosphatase deficiency. Now, interestingly, there was two questions from myasthenia gravis, the first half as well as in the second half, and the key word was in both of them was, in the morning there is no clinical feature. In the morning there is no clinical feature, but in the evening the patient was having ptosis, having muscle weakness. Right, that was the key that was there, and both of them. In one of the MCQ they have mentioned about neostigmine also, but whether you know about that or not, but if you know this much amount of data, morning may there is no problem, but towards the end of the day, ptosis. it was myasthenia gravis. Then there was inflammation in the intestine. They have asked about the most sensitive and the most specific antibody, that was the anti-TTG antibody. These are the screenshots that I am showing to you. These are the screenshots of the quick revision session that we had for 3 days, and from these 3 days till now I have got 75 direct questions. I am just showing you the screenshots of the students' notes, and there was 75 plus direct question till now I have received from this QRS, which we had at Rise Medical Academy for 3 days. Then there was a question from sickle cell anemia about the where is the mutation. It is the beta chain, 6th position. The glutamic acid will be replaced by valine. The next question we have already discussed, that was the antidote of iron toxicity, that was the 𝗙𝗲𝗃. Now this question was asked in the reverse direction. If there is an antibody against the basement membrane, it will lead to which condition? Antibody against basement membrane leads to Gout-Pasteur syndrome. Now there was a question from the congenital hyperbilirubinemia. Now what they have mentioned was, they have given the value of the total bilirubin, they have given the value of the direct bilirubin. Direct means the conjugated one. The conjugated was not increased. What was increased was the unconjugated one, and unconjugated is increased in 2 conditions, the Gilbert and Crigler-Najjar, and Crigler-Najjar was not in the option, so the answer was the Gilbert syndrome. Then there was the Child-Pugh criteria that they have asked which of the following is the component of the Child-Pugh criteria. They have given big options were there, and you have to find out all the 5 were in which was provided in which of the following, and most of the students were able to answer this because they were knowing that Child-Pugh has ascites in that, and there was only one option which was mentioning ascites as a component. So based on that, they have figured out the answer. Then there was a question from the recurrent lung infection. Recurrent lung infection, steatoria, we have discussed in the class of the pulmonology as well as in the QRS session also, and that was a straight question, cystic fibrosis. Now see how the question was framed. They have asked that testosterone is synthesized where, right? And testosterone, we know that testosterone is synthesized in the leading cell. And interestingly, if you see, just after 3 lines we have written in the revision session that testosterone is the molecule which is synthesized from cholesterol, right? This is what we have written. And how they have framed the question, testosterone is synthesized where, right? And the options was leading cell from cholesterol, leading cell with some other molecule, and likewise they have mentioned the MCQ. So based on these 2 statements, you would have corrected the answer. The leading cell from the cholesterol, we are making the testosterone. The next question was based on the Samters triad. They have told that there is a person who is having taken the aspirin, and after taking aspirin, the patient is having wheezing, right? Means the bronchial asthma that he was having. They have asked that it is associated with what? It is associated with the nasal polyp, right? It's the Samters triad. The next was the question of the pheochromocytoma. They have given the clinical scenario. The patient was having episodic palpitations, sweating, headache, hypertension. That was a pheochromocytoma question that was there. Then there was a question from the pathology retinoblastoma, that they have given the scenario that the enucleation was done. The picture of the retinoblastoma means the clinical scenario of retinoblastoma was there. They have asked that which gene is involved, is the RB gene is involved. See here, if you see, just after that we have written this statement that was asked in your exam, the contraindication of the breastfeeding, that was galactosemia. That was the direct question that they have asked. Then from here, from one single slide, again 2 questions. Reed-Sternberg cell, and seen in which condition? Reed-Sternberg is the Hodgkin lymphoma, and the oval eye appearance, that is also the cytomegalovirus, right? So the Reed-Sternberg cell is the Hodgkin lymphoma, and the oval eye is the cytomegalovirus. Now there was a question that they have mentioned, there is a drug which is working on the PPAR, right? PPAR, the drug that is working is the fibrates, and they have asked from the pharmacology that which of the following works on the PPAR. The PPAR, the drug that works is the gamfibrozil was in the option. Now there was a question on labetalol, that labetalol, what is the mechanism? This is the alpha blocker, beta blocker, it's alpha plus beta blocker, Then the chemotherapy induced nausea. They have mentioned the question that which of the following drugs can be used for the chemotherapy induced nausea, right? And they have given the multiple drug combination, and in one of the combination there was the drug cetron, that is ondansetron. So ondansetron, the choice where we having the word setron, that was the group that you have to select. So chemotherapy induced nausea, we give ondansetron or the setron group of the drugs. Then there was 3 questions from Gout. Here itself, I will tell you all the 3 questions. The first question that was there was, they have told there is the knee joint involvement, and when the synovial fluid aspiration was done, there was a negatively birefringent crystals were there. See, knee joint doesn't mean that it is always going to be pseudo gout, right? Pseudo gout, positively birefringent. They have clear cut mentioned negatively birefringent. Negatively birefringent is the gout, is the uric acid crystals, right? So the answer was the gout. The second question was, there is a lady who is suffering from gout. She is taking some medication. What is the mechanism of the drug that she is taking for chronic gout? That was the xanthine oxidase inhibitor that she was taking. The third was that there is a person who is having gout, and you are going to give a drug that is going to increase the secretion of the uric acid in the urine, and the answer to that was the probenecid. So there were 3 questions from gout, 2 from the pharmacology aspect and 1 from the medicine part. Then the image was given, and they have asked that it is due to what, and we have clearly written it is due to blockage of the lymphatics. The option was the blockage of the superficial lymphatics. Actually, they have given the option superficial lymphatics, superficial vein, deep vein, something like this. So if you were knowing that much, kids, blockage of the lymphatics, you would have corrected the answer. It's the blockage of the superficial lymphatics. Then there was a question from the BRCA1 and BRCA2, right? All of the following are true except the BRCA1 is just not there in the mutation, is not related with the malignancies in the female. It is also there in the malignancy in the males. It can lead to multiple malignancies, gallbladder, stomach, prostate cancer. So based on that, if you were knowing this table, you could have corrected the answer. Then there was a question from horseshoe kidney. They have given the radio imaging. I don't know, they have given the MRI or the CT scan, but they have given the radio imaging of the abdomen, and they have asked that what is this diagnosis, and it's clear cut is the horseshoe kidney, right? Then the next question from the forensic was they have mentioned that all of the following are used for the blood stains except, right? And we have mentioned that Barberio test, it is done to detect semen. It is not for the blood. It's not for the blood. So answer to that question was Barberio test. Then there was 2 questions from the level of prevention. The first was the hand washing. Hand washing in this era of the COVID to prevent the COVID, that is the primary type of prevention, because the risk factor is there and we are preventing the disease to happen, right? So hand washing will come under the primary level. And second was that there was some organization was given, and वो बता रहे थे कि they are increasing the awareness that the smoking leads to lung cancer. Lung cancer is a disease, smoking is a risk factor, and what they are trying to do is they are trying to decrease the risk factor. Now when you prevent the emergence of the risk factor, that is going to be the primordial level of prevention. Then the question number 46, it was clear cut. The long question was given, but the answer hidden was कि asbestosis उन्होंने लिखा था कि it leads to what? Asbestosis exposure was there, it leads to mesothelioma. Then not the X-ray was given, but either the CT or MRI was given, and they have mentioned put an arrow, and they have asked that what is this sinus? This is the maxillary sinus. They have given the question, there is a patient who is having uncontrolled diabetes, and we have clear cut mentioned uncontrolled diabetes with this black color mass that is there. It is mucormycosis. Now, in the Ramsay-Hunt syndrome, what they have clear-cut mentioned these words: vesicles in the ear with the element type of facial palsy, right? So what they have asked was कि we have understood कि vesicle हो रहा है, facial palsy is there, it's Ramsay-Hunt syndrome. They have asked कि Ramsay-Hunt, what is the diagnosis? Ramsay-Hunt syndrome due to involvement of the basal ganglia, geniculate ganglion. See, obviously there is nothing to do with the basal ganglia. It is the geniculate ganglion where the reactivation of the virus happens, right? So Ramsay-Hunt, it is the element type of the facial palsy that is related with the geniculate ganglion. Then this image was given, the bitemporal hemianopia was there, and we know that it is due to compression of the optic chiasm. Now here, again the things are not very clear, but what they have mentioned, what I have got from the students from you is there was mentioned about a ring, there was liver enzymes were deranged, liver dysfunction was there, psychiatric symptoms were there, right? The color of the ring was, I have got the mix recalls. So either it's a hemochromatosis or Wilson. If they have mentioned the brown color ring on the periphery, liver dysfunction with the psychiatric symptom, then it's more likely going towards the Wilson disease. Then there was a question that the lacrimal sac, yes, you can see we have clear cut mentioned in the diagram that lacrimal gland is in the outer superior quadrant, but the sac is on the medial floor of the orbit, medial floor of the orbit. You can see in the diagram also. Then it's a clear cut, the cherry red spot is seen in CRAO. Then from anesthesia, the agent of choice for the induction in the pediatric age group, which was we have discussed, it's sevoflurane. This a small image of the silver scale that was given. A silver scale, straightforward psoriasis. From lichen planus, the question was not about the 𝗬𝗃𝗃 actually. They have mentioned that the patient is having some lesions, the pleuritic regions are there, the plain purple color lesions are there, but they have also mentioned that on the oral mucosa there is a white lacy lesion is there, and that is the 𝗬𝗃𝗃, right? And based on that, we could have made it correct answer, this lichen planus. Then there was a question from the image was given of the various opening of the diaphragm, and it was a cadaveric image. It's a little difficult to appreciate the things of the things and the objects there. That what they have asked about the various openings and something like this, but the exact question I was not able to get the inputs from your side. But many of saying was ki they have mentioned about the azygous vein and aorta, or maybe the long thoracic duct, something. So based on this, there was one question that was there. Then now this was a standard question. Collagen formation requires which of the following? We know that ascorbic acid is required, that is vitamin C, and along with that, during the biochemistry class, we have also mentioned the copper is also required. If you remember the lysyl oxidase, right? So the answer was collagen formation requires what? We require ascorbic acid, that is vitamin C, along with the copper, But still, if you just know ascorbic acid, you could have corrected the answer. Kwashiorkor. Now, Kwashiorkor, the exact line they have mentioned in the MCQ, protein deficiency is more than calorie deficiency. I have told you कि बच्चा खा तो रहा है, but the main problem is he is not taking the protein in the diet, right? So that was leading to the Kwashiorkor. So Kwashiorkor, that they have given the image of the baby, it's edema that was there. It is because of the protein deficiency is more than the calorie deficiency, Duchenne's is due to defect in which protein? It is due to defect in the dystrophin. They have given the Gower sign. The child is having the Duchenne's muscular dystrophy, proximal muscle weakness. It is due to defect of the dystrophin protein. A clear cut, the same language was given from minimal change disease. Minimal change disease, they have given that in the routine microscopy there is no change, but in the electron microscopy there is effacement of the podocyte, is responding towards the steroid. So it was going towards the minimal change disease. Then the direct line, the best parameter to find out the age of gestation, it is the crown rump length, CRL, crown rump length. There was a question from the vulvovaginal infection, and they have mentioned that the secretion is frothy. Frothy secretions were there with foul smelling, and we have clear cut mentioned the frothy foul smelling it is, and they have mentioned about the flagella also. So it is the trichomonias vaginalis, so trichomoniasis. Then copper T 380A, the lifespan was asked, it is 10 years. So the gout, and this was the negatively birefringent crystals. It is gout, negatively birefringent, anywhere it is mentioned, it is going to be gout. Then there was a question from the G6PD deficiency. They have mentioned about the hemolytic anemia, which disease can lead to hemolytic anemia. It is the G6PD deficiency. Then there was a question in that they have mentioned that there is a lady and she is having joint stiffness, particularly in the morning, and as the day progresses, the symptoms decreases, the clinical feature decreases as the day progresses. It is rheumatoid arthritis, right? Which vessels has the maximum resistance? We have mentioned in the physiology, it is the resistance vessel is the arterioles. When we go to the high altitude, what happens with the shift? It is the right shift. There is going to be increase in the 2,3-DPG that we see at the high altitudes. We have discussed in the oxygen hemoglobin dissociation curve concept. Then straightforward question: what is the local macrophage of the liver? The local macrophage that is liver in the liver is the Kupffer cells. Then there was some question that I have given some fungal infection, and for treating for that either ketoconazole or fluconazole, means the azole group of drug was mentioned there. The mechanism of that is the estradiol synthesis inhibitor. Right. So till now, almost around 70-75 questions. These were the direct questions, 75 questions, which we have figured out from this 3 dates revision session. We are still working on it, and as your more inputs will come from your side, we'll fine tune these things and we'll get back to you. Right. And I hope आपका एग्जाम बहुत अच्छा गया होगा. Wish you all the best for your results. Right. Thank you guys.